Let's talk some more about it. We're joined now by Dr. Helen Wall. Helen, morning.
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 This isn't new, is that? I've heard companies flogging shakes in the past. What's different about this?
I think what's different about this is it's part of a study, and we've done the pilot study around England for a couple of years now, I think since 2020, and I've been referring patients into this programme because Greater Manchester was one of those sites. So what's different about it is it's very much supported by the NHS. People don't just get the weight loss, which happens within the first 12 weeks with the soups and shakes. They then get that reintroduction to food and that one-to-one coaching and support for a 12-month period to really sort of help them to get back into how to eat healthily and how to actually keep the weight off. And that's the really important bit, because we know that if you drop your calories, I think this is sort of less than 850 calories a day, we know that you're going to lose weight. But how do you then get back into normal life and come out of that phase of just being able to live on soups and shakes, which in itself is really, really difficult. I think the dropout rate was about, I think only 1 in 7 completed the 12 months. So it is a really difficult thing to do. It's not an easy fix.
And it's quite resource heavy, isn't it, in terms of the sort of NHS, this is on prescription. But obviously we have to understand that type 2 diabetes is such a massive health issue, and it appears from these results that this works.
I think it's really positive. Type 2 diabetes, and we have to be very clear that this is about type 2 diabetes, which is completely different to type 1. Type 2 diabetes patients, it's complex, but many patients have excess fat which around their middle, which then gets around the liver and the pancreas, which are both responsible for diabetic control, insulin production, and so on. So, we've known for a long time that losing weight can put diabetes into remission. But what this has shown us that if we can drop that weight quickly, quite early on in the diabetes diagnosis, we can. In this study, they got a third of those individuals into remission. And it's important that we labour that point, remission, because we never say that somebody is cured from diabetes. We always say that there's we still expect them to come to their annual checks and check for any damage to the eyes and kidneys and so on.
The trick in all of these sorts of things as well is how you fit this into a normal life, because people will have events to go to.
Exactly.
They'll have nice things that they want to attend. There's Christmases, there's birthdays, there's occasions. This doesn't fit in, does it? Because if all you're allowed is a soup and a shake, albeit for 12 weeks, it's about trying to do everything in moderation. Is it sustainable?
Well, I think that's the beauty of this programme. You get the 12 weeks, which is a massive commitment for patients. They have to go through some prior, work before they start this, because it is a huge commitment, as you said. But, I think the beauty is that they then get this one-to-one coaching. And the patients that I've sent on it when we've done the pilot in Manchester I've had a few patients who've really felt that they've been well supported. And I think the difference is that they get that one-to-one coaching, that support to really sort of get back into normality, really. But there's no getting away from the fact that the first 12 weeks of this will be hell, really. I mean, you have to have commitment. It's not a quick fix.
But the evidence is if you can stick with it and gradually reintroduce solid
for most
foodstuffs.
people, I don't think it necessarily works for everybody, but we know that if you can stick with it and drop that weight, and most people lost about 15 kilograms on average. So we're thinking, 5 to 10% of your starting body weight. We know that a third of people in this study went into remission, which means their diabetic level went completely back to pre-diabetic levels, back to the normal population levels for at least 3 months or more, which is massively impacting their long-term health for the good.
Dr. Helen, good to talk to you.
Thank you.
Thank you.
Thank you. Now then, it's your